So the tibia, which is the medial of the lower limb bones, is considerably wider, more robust, and it's really the weight-bearing bone. Whereas the fibula, which is what we're looking at now, is not a weight-bearing bone. Its main function is in terms of muscle attachment. And you can see, particularly on the shaft or the body of the fibula, all these lines where certain muscles attach, particularly those on the anterior leg. Now, one of the main questions I get asked about in terms of the fibula is which way's up and which way's down. And that's because the head and the distal end of the fibula are actually pretty similar in terms of appearance. So let's start with the more proximal portion, or the head. Now, I always describe it as a bit more robust, and in terms of its smooth articular surface, that's going to be facing up or superiorly. So you have a smaller facet in terms of articulation there. Now, right underneath it, you have the thinner neck, which is pretty typical in terms of any type of anatomical neck. It's generally a little bit thinner than the other areas. And then lastly, the most distal portion of the fibula is what's referred to as the lateral malleolus. Sometimes you'll hear malleolus. Both are correct. Now, I want everyone to touch the side of their ankle and feel that big projection or that bump. This is what you're feeling. You're feeling this lateral malleolus. So you know that this has to be the most distal portion of the bone. And you're going to have a more substantial smooth area because this is articulating with the talus, forming one portion of the ankle joint.